So today we've got 3 members of the Nursing Midwifery Health Program Victoria team that I'd love to introduce to you, and they'll be leading you through this webinar. First up is Glenn Taylor, who's the CEO with the NMHPV. Then we have Carolyn, who's a registered nurse with the NMHPV, and Kay-Ann, who is a registered nurse and credentialed mental health nurse. So welcome and hello to our panel, and over to you, Glenn, and I'll speak to you a bit later in the Q&A. Thanks very much.
Thanks very much, and welcome to you all today. Thank you very much for coming. It's our first webinar, as Mark said, and we're really excited to have you on board. As Mark said, my name's Glenn Taylor. I'm the CEO of the NMHPV. I'm also a registered nurse, and I've worked with the organisation since 2008. But today's webinar is really our way of shedding light on the service and really about challenging myths about nurse and midwife help seeking. The organisation commenced in 2006. It's specifically designed by nurses, it's led by nurses, and it's provided by nurses and midwives. Importantly, you should know that it's free, it's confidential, and it's independent. And our purpose really is just to support nurses, midwives, and students, and HR managements and employers with the sensitive health concerns that we know go on, and we know that our colleagues experience and continue to experience in the field. When we talk about sensitive health concerns, we're talking about mental health challenges, alcohol and drug problems, family violence concerns, and really anything that is having an impact on an individual's health and well-being. We know that nursing and midwifery is a tough gig. It's physically, psychologically, emotionally, and spiritually really challenging. And we exist because nurses and midwives are pretty lousy at help seeking. So it's commonly believed that needing help is weak. We as in those in the profession, fear identification, judgment, discrimination. We fear we'll lose our jobs. We fear we'll lose our registration. So we provide help to challenge these myths really, because that is just not the case. We want to work to ensure that those myths are broken down, and that anyone who needs our help can come to us. So prior to 2006, a focus group of nurses with health concerns, these types of health concerns, identified the barriers to seeking help, and those included fear of identification, shame, isolation, and loneliness. And importantly, they suggested that this could be fixed or remedied by a nurse-specific program or a midwife-specific program, which was free, confidential, and independent. So today, we're all about telling you or helping you to understand how this works and how it can help you or a colleague, and to also reinforce that being or not being okay is perfectly okay. So let's start the forum by asking, why is your health, well-being, and self-care so important? And this is an ideal opportunity to throw it over to Carolyn McDonald, my colleague. Carolyn, perhaps you could start by introducing yourself and giving us a bit of an insight into that question.
Thanks, Glenn. Yes, I'm Carolyn. I started with the Nursing Midwifery Health Program in 2009, and I love this work. My experience has been in general nursing, critical care areas, spent some time in theatre, and then moved into mental health and community and drug and alcohol. So my experience is, many and varied. Yeah, starting with the question about, who comes to see us, like who actually calls and makes contact. And we see nurses and midwives and students of nursing, graduates, managers, ANUMs, NUMs, executive level have called us for, not only support, but also guidance in situations. And nurse educators are another group of nurses and midwife educators that do call us. And next question we're covering is, why would you contact us? What would be the reasons? And nursing and midwifery, as Glenn alluded to, is a very stressful profession, and they're slightly different from each other, but they still have a lot of the same stresses we all experience. And the fact is that we have high personal and community expectations, like nurses and nurses are voted the most trusted profession. You know, there's a bit of pressure. You know, staffing levels, patient acuity when we're in the workplace, feelings of inability to influence the workplace. You know, sometimes you can feel like you don't have a voice, limited opportunities for debriefing and peer supervision. You know, location and environmental factors can also have an influence on our health and well-being, like being under no natural light. You know, some areas where nurses and midwives work, they don't have any windows or no natural light. You know, there's just those little things that we don't realise what influence and make our job a little bit harder. New technology has an impact, you know, and in these times we're all dealing with new technology. I can see my colleague laughing because I did have a technology problem just before this webinar, but here I am. You know, exposure to risk, workplace assault, you know, like at this time where you know, COVID, like nurses are on the front line, so we understand like that's a highly anxiety producing situation. Workplace assault, of course, nurses and midwives are always potential for that, bullying and harassment. So all of these situations are all reasons why, you know, nurses may contact us. More on a more personal level, you know, it's work and study stress and social circumstances, potentially no connection. You might have family history of domestic violence or substance use, or you know, I like to call it maladaptive coping strategies. You know, sometimes it's just about developing new ways to deal with the job, you know, and the stresses that you have. You know, and we see anyone, like Glenn was saying, with sensitive health issues, so anything that falls under mental health or substance use concerns. And Kayam will talk more about this, you know, with common presentations when she follows me. And I think I'm continuing on. Yeah, why wouldn't you contact us? You know, this is probably a really, you know, really about how NMHPV developed was around what prevents nurses and midwives asking for help. You know, and I've just alluded to some of the stresses of the job, but actually, you know, there's a lot of reasons. You've just got a poll there, which you know, once the minute's up, I'll hopefully talk to. But there's, you know, there's some known barriers for nurses and midwives actually accessing help. So the poll is about what would prevent you from asking for help. And if there's anything there that, you know, you feel like you may feel, like, feel free to fill that in. Some of the things that we do know about with the evidence, you know, with studies of our profession, there's huge fear, you know, which Glenn alluded to in the introduction, huge fear, and stigma associated with any mental health or problematic substance use. So, you know, and also nurses, I mean, so many times I'm asked about, you know, what about my registration? You know, I'm seeking help, but what about my registration? People are really fearful about their employment and their registration. There's a lot of shame, there's a lot of isolation associated with mental health issues and problematic substance use. Loneliness, you know, often that feeling of no one will understand my job, no one will understand what pressure I'm under. Fantastic. So, and the poll results are showing that, you know, 30% of fear, 45% shame. So, you know, that's a really big one. The repercussions, the loss of registration, reporting, identification. So everybody, you know, there's fear, a lot of fear, like for all of those reasons. Keeping it together, you know, like this is nurses and midwives are really resilient and often will keep it together until the last moment, you know, so actually not waiting for a crisis, but actually seeking some help beforehand. And basically, you know, our service was set up for that reason, like to actually be able to, yeah, seek help before that point. So I think I'm now handing over to Kayan, who is we're going to ask what are the questions we are most commonly asked.
Hi, my name's Kayan Branchstaff. I'm a registered nurse and my background is actually in mental health and drug and alcohol. I've been employed on this program for the last 2.5 years, and what an eye-opener it's been. I'm constantly still going to Glenn and Carolyn and seeking advice and saying, I'm stunned by this situation. What do we do? How do nurses end up in these situations? So yeah, it's amazing. Look, the questions that we're most commonly asked are the ones we're endeavouring to answer today. We want to talk about what we are, who we are, what we offer, the presenting issues. Does anyone else have these issues? We all think we're the only one. And what you can expect of our service and how to contact us. They're the main things we want to answer. But in addition to that, we get a lot of questions related to that fear that Carolyn and Glenn have both talked about. It's something we work with daily in this job, of people disclosing their AOD, mental health or family domestic violence issues, the repercussions, all of that. There's a lot of questions around confidentiality. There's a lot of questions around bullying, what it is, whether I'm being bullied. I think I'm being bullied. I don't know if I'm being bullied. Am I a bully? Lots of questions around that. So we deal with that on a day-to-day basis. And nearly every phone call, we're looking at helping people to manage their anxiety and stress, how to work with that. The other theme that's come through for me over the last 2.5 years are the transitions from undergrad to grad, from grad to RN, from RN to management or whatever, retirement, older nurses ringing in, managing those transitions in our nursing career and our nursing life. So lots of questions around that. We also get asked a lot about what the common presentations are and what are our colleagues experiencing. Well, clearly at the moment, COVID is the thing. COVID-19 related concerns even in people who are ringing not about COVID, COVID is having an impact. So we're dealing with a lot of that. Fears around their safety, guilt, shame, if they can't work or because they're not well or they're frightened to work. That's part of it. There's the anxiety, there's the fatigue, there's the real sense for some nurses that their careers have been derailed or have come to an end. I've had several older nurses recently who was talking about not returning to the role they had. They haven't been able to continue in that role because of autoimmune disorders or whatever, and they don't think they'll go back. They think this is it for them. We get financial hardship, the loss of hours in employment affected a lot, and sadly for our colleagues who are experiencing family domestic violence, we're getting quite a few presentations of nurses in that situation. Nurses and midwives, are overrepresented in FDV, and this COVID pandemic has really highlighted these people have lost their safe place. Work is their safe place, and they've lost that, and they can't go out and spend time with friends or family. They don't have a safe place anymore, so please be aware of that with your colleagues. The other group are the bushfire nurses. At the start of the year, they went through horrendous times. They fought fires, they lost property, and they continued to provide services to their community. We do not understand how they did that. We're on the verge of addressing that, and COVID came along and put an end to us reaching out. So we're desperately always trying to find ways to reach that group, and we invite them to contact us for support. That's currently. Usually we're also seeing nurses and midwives under the 3 headings that you'll see on our website. Our primary function, substance use issues, mental health issues, which could be anything from mild anxiety and a transition issue to major personal crisis, trauma, mental illness, and family domestic violence. And we very much pride ourselves on being a gateway to people in family domestic violence achieving the level of safety and support that they need. I guess the other thing that we deal with a lot is the drug and alcohol people or mental health people who are coming back via AHPRA and they're under conditions. So we do provide a real service to nurses or midwives in that situation. Okay. Glenn. Glenn, a poll came up while I was talking. I'm sorry, the polls distract me. This is new for me, and I'm what the hell is that? Okay, so a poll came up asking you how to prioritise your self-care, and Glenn's going to address that in his session now.
We'll get to that a little bit down the track. So one of the other questions that is commonly asked of us is how do you or how would you know if you needed help? So what are the red flags or warning signs? And because often we are the last one to identify that we need help. So sometimes it's about just ensuring that you've got someone who you can trust, who will tap you on the shoulder if you're concerned or if they're concerned about you. But the red flags that we kind of identify, which are really simple to try to understand, are around sleep impairment, changes to diet or appetite, concentration impairment, so people who can't focus on a task or a duty, or even just getting things done in their own lives, lack of enjoyment, social isolation, the fear which has been discussed earlier, or unfounded fear, or over concentrated fear. Dread, so dreading to go to work or dreading getting out of bed. And really importantly, ruminating. So this is one of the things that is common with a lot of the presentations of our colleagues that we see, is just they're not able to switch off and they're focused really heavily on something which is full of dread. It's obviously it's okay to have some of these some of the time for a brief period of time. But if they persist, it's really important that you reach out for that, or the person reaches out for professional help, and that could be including us. That's really something that we've sort of talked about a lot over the course of our lifespan in this organisation. Interestingly, this is in front of you now. So the red flags that you're identifying, irritability, I think that's coming up as a big scorer on this one at the moment, and I think that really is we are a microcosm of the greatest society, our greatest society, and I think there's a hell of a lot of irritability out there now with what's happening in our society. So these things again are okay. It's okay to feel these ways, these things sometimes for a short period of time, but we really do want to ensure that we don't let these get too big or get out of hand. And that's where a trusted colleague or a friend or a family member is really important. So interestingly, 70% of you identified irritability as being an issue. Use of alcohol and drugs was 20%. The other scorer was mood changes and anxiety, and they're things which really most people that we see here would experience those types of things. So thank you very much for doing that. That's given us real insight, and yourselves an insight into the sort of things that we're experiencing in this work. I'll throw you back over to Carolyn now, and she's going to pick up on what you can expect from us.
Thanks, Glenn. Yeah, what you can expect from us. So, and I guess, you know, this is also, you know, for friends or colleagues that you see, that you can see their red flags, but maybe they can't see them, as Glenn alluded to. So basically, you know, with that first phone call or contact, you can expect a supportive and respectful and collegial relationship. So, because we're nurses and midwives, we understand the job that you do. It's free, it's confidential, and it's independent. So government funds the program, which I think is a really, you know, testament to our government actually caring about your health and well-being and the health and well-being of your colleagues. There's an ease of access so that you just, you can phone, and Kayan's going to talk about how to make contact with us if you or anyone else needs, but we have a beautiful receptionist that will answer your call. And basically Julie will often gauge the issue that might be at hand and the urgency of it, and you'll be receiving support within, say, 48 hours. So obviously if it's really urgent, same day. The other thing that we have connection to is NM support, which is 24 hours you know, available to you, which I think again KM will talk more about. Trusted referral pathway. So we've been, you know, we've been in operation for a long time now. We've actually got some really good connections with, you know, the service providers, any, you know, referral pathways. So people have given us feedback about people we know. So those relationships have already been developed. Proven benefits and positive outcomes. So we, you know, got a lot of people who will testify to that. You know, so on that initial conversation that you have with someone, you'll make a connection to a clinician. We've got 8 staff on now, so it can be any one of the 8. We all work in a client-centered approach, so our approach is actually to work with you personally and work out develop a plan, you know, to help you with what your needs are. And all the counselling is strength-based. So, you know, as I was saying before, nurses and midwives are incredibly resilient and often have solutions to their own problems and just need a little bit of help finding it. You know, having said that, we also take into account any other situation that might be going on, like Kayanne talked about, you know, maybe supporting you through the process with APRA or working alongside the ANMF if there's, you know, other more systemic, you know, issues going on. Basically, a plan is made and it's always developed with the client. Obviously, all of our you know, connection with people now is no longer face-to-face, but actually over phone or over Zoom. So yeah, we've all made adjustments to this time, you know, and it takes a little bit of getting used to, but actually we can still achieve the same results. So you know, generally could be one phone session. So sometimes it is one, you know, and that first phone call often can be 45 to 60 minutes just to work out what's happening and what the needs of the person might be, the nurse or midwife, and then basically working out if it will turn into an episode and maybe there's a longer term issue going on that needs further support. As I was saying, we're free because we're government funded. You know, and as Glenn was saying, we're developed by nurses and we have a midwife on staff. We're guided by, you know, nurses and midwife. We know your job. And I can't tell you how many times that someone comes in and starts talking about a situation and I can nod and agree and they're just so relieved that we understand, you know, and I think that's a real, you know, it's a really important factor of our program and support that we can provide. So the other question that I have on my list of questions to answer is, what else do we offer? So back in the days where we could all gather together in the same room, we were doing training and wellbeing presentations. And as an avenue of, you know, spreading information about us, or at least educating people in the same way as this webinar is working, was training our champions. So we have a really large you know, a large number of people who are trained in NMHP champion and will actually be, you know, they're a part of our voice, you know, in the wards. And we used to be able to work with them to go into wards or to develop, you know, presentations for them to educate their staff on, you know, support available to people. All of that is going to be adapted. You know, we're always in the, we're you know, using all this new technology and seeing what we can develop in relation to those things. So, you know, just keep you posted, you know, on the website and through social media. You'll be hearing more about our presence, you know, now on webinars, etc. Yeah, also, we also used to, again, travel to rural areas, knowing how hard it is for nurses who are out in regional areas to access help and support. So instead of, you know, having them trying to come to us to Melbourne, we would go to those areas. But obviously now we're all connecting over technology. So, which is really great because it means it can be incorporated as an ongoing, you know, practice of ours. And now I'm going to hand over to Kayanne, and she's going to tell you how you can contact us or recommend one of your colleagues contact us if they need. Thanks.
Thanks, Carolyn. Look, basically, we're fairly easy to contact. There's two main ways to do it. One is our landline. We run office hours, Monday to Friday, 8:30 to 5 p.m. The number's on the website, 9415 7551, and our office manager, Julie, takes those incoming calls. You can leave a message anytime, and Julie does say that a lot of the calls come in after hours. There's voicemails left at 11 o'clock at night. So that makes sense to me. You get home, you're tired, you've had enough. I need to talk to someone. That's it, I've had enough. The other way to do it is via our website. I think you click on contacts and that will take you through to an email inquiry section, the phone number and an email address, or you can go through referrals. Click on services and then referrals. I know that one. And you can look at the different types of referrals. So there's a self-referral where you disclose your information and send that in by email. There's also the employee assisted referral. And that may be that an employer or manager or someone in the organisation is so concerned that they're having a consult with us and asking us to contact you. And we contact you. So that can be there as well. I guess making a referral for someone who you think is needing support is a big thing to do. And I know that the person who asked that question is good at it, because she did it for me 35 years ago, gave me a heads up and said, well, listen, you're out of control here, you know, you're burning out. And she was so right. She saved my career, in fact, by giving me that feedback. And all she said was, are you okay? And that's the model we use. We use the model, are you okay? Why reinvent the wheel? It's a wonderful model. When we do our training for Champion Days, where we train people to be ambassadors for our program, we spend a lot of time on this. We do role plays. We talk about the scenarios, the potential outcomes of asking a colleague, do you think you need some help? If you're coming from a place of genuine concern and respect and being willing just to listen, you usually, almost always, get a fairly positive response. Okay, I'll leave that with you though. Ring us and talk to us if you have a particular concern. We do that sort of consultation. You don't have to mention the person's name if you're worried about their confidentiality. Okay, Glenn.
Thanks, Kate. So for me, as a participant of a webinar like this, I think it's really important that you go away with more information. So thank you to those people who so generously logged questions at registration. This makes it so much easier for us to know what to talk to you about and what sort of information to give you today. So we've got the list in front of us and we're just going to divvy those up and go through. So hopefully this will enlighten you. So one of the first questions was, over the life of the program, have the issues confronting nurses changed? And that is definitely, I can definitely say that has, and it's included increased stress and anxiety, and the intensity and the complexity, I think, are the things there. There's always been stress and anxiety, but those have really intensified. The busyness of life, and the business of life, I think, is also further complicating things. And we also have noted concerns around people who are feeling bullied in the workplace. So that's probably, in a nutshell, over the time that I've been in the organisation. Throw you over to Kayanne now.
Okay, we had a question about tips to aid sleep, and I think as nurses and midwives, we just have to accept that sometimes we're not going to get a good sleep for a range of reasons. It's a common theme. It's something we talk about a lot with people who ring in. I really advise people to stop thinking about sleep and focus on rest. See it as downtime. For the next 6 to 8 hours, you don't have to do anything. The situation's not going to get worse overnight. Nobody's actually doing anything about it anyway. They're all in bed asleep. Why shouldn't you have your time? So focus on your sleep hygiene. You know about all that stuff. And then really look at how you're talking to yourself. Really look at, are you giving yourself the message that you can't sleep? Or can you just make yourself comfortable? Focus on being comfortable. Focus on muscle relaxation, however you do that. Is it warm baths? Is it a hot shower? Is it rubbing in some magnesium oil in your calves? Is it listening to music or sound, doing a relaxation? Muscle relaxation, focus on comfort. If necessary, go and see your GP. If it lasts more than a few nights, you do need to go and get a review of your mood and of your sleep, and it may be that you need something to help you sleep. I think most GPs give nurses melatonin to start off with. I'll leave that for you to discuss with your GP. Try and see a GP that you know and trust, that knows you, okay? The other big tip I have is to check our website. We've got this amazing wellness toolkit there, and there's a really good section on sleep where you click in and there's all these options, different websites, different links to where you can explore the concept of sleep. And just before I finish that question, I want to let Carolyn have the last word about sleep.
I just wanted to share in the ANMJ, there's this beautiful line about sleep. Sleep is like a butterfly. You cannot reach out and grab it and catch it. If you stay quiet and still, the butterfly will come to you, and it is the same with sleep. And it just really like resonated with me. So thanks, Kayanne, for letting me share that.
Okay. There we go. The next question we got asked was around the lack of support for whistleblowers, and sadly that's just so true. There is a lack of support, there's a lack of knowledge about the implications of reporting outside your organisation, because that's in effect what you do. Our first thing you need to do is ring the union. You need to have a consultation with your union. You need to line up some advocacy and a legal referral. If you're not in the union, get some legal support. Ring the Women's Legal Service of Victoria if you're a woman. If you're a man, you need to go to a lawyer, okay? And be aware that there are differences between how the private sector and the public sector respond to whistleblowing. The union and the lawyer will guide you through that. Our role, we very much very willing to have a role in supporting you through that process for however long it takes. And the focus of our support is around increasing your coping skills, helping you keep it in perspective, and having realistic expectations of what your role is and what the outcome will be for you and your organisation. Also, a big focus on maintaining your life balance. I've got a couple of people at the moment I'm working with who I'm supporting through their whistleblowing experience. And I said to one the other day, I'm about to give you a serve, and she said, I'm walking, I'm exercising. So she knows, she's learned, she's got to keep her life balance going. And it wasn't even about that. So there you go. But whistleblowing, it is a big issue. Please ring us to consult, but you must have your industrial legal things in place as well as us for that personal individual support. Okay.
And it's back to me. And my question was, how do you facilitate a phone call inquiry from a client? What process do you go through? And what is the most difficult part? As I said earlier, the first phone call generally is around 45. I think I've got some internet issues. Can you hear me okay? Sorry. First phone call is around 45 to 60 minutes, and it's about, reassuring of the confidentiality, and it's definitely the client-driven process. So it's really listening and clarifying, identifying supports and developing a plan. And it will depend on what the content of the call is about whether it turns into an episode or actually stays as a one-off or a brief intervention. And the last part of that question was, what is the most difficult part? And I don't think that we have a difficult part in that process. Actually, I think the difficulty is, getting the courage to call. So, I don't find that part at all difficult. So, and I'll hand over to Glenn.
Thanks, Carolyn. A couple of questions around, does your team provide group support if a nursing team is struggling? Another one along those lines is, we have only been able to have a couple of graduate study days. How is a cohort of graduate nurses meant to connect with that support? So really what we'd suggest around that is that thanks to the Victorian State Government for its recent boosting of their funding, it's enabled us to be able to provide more online groups. So I'd firstly encourage you to give us a call or email us, and so we can negotiate to get online with you just like this, from our office or our home to your workplace. So that's something that we're introducing. We're calling this Q&A with NMHPV, which is a new sort of a consultation process. As far as the graduate nurse question goes, always good if you can try to engage the graduate nurse coordinator firstly, to ensure that they're on board, and we can certainly help facilitate something there. The other question was, how long after initial contact does it take for a nurse to have a support meeting or a phone call? Carolyn mentioned earlier, it could be as soon as 24 to 48 hours, though business hours that is, but typically it would be within 5 to 7 days that there'd be that first assessment contact. And in the meantime, we do provide you with a whole range of supports and other information to get you through. Over to Carolyn.
Thanks, Glenn. My next question was word of mouth referral. How do we capitalise on the great work that the counsellors do? Well, we do capitalise on it in that there are lots of word of mouth referrals. So people will often refer other nurses and midwives that they might know to the program. We have often experienced nurses saying that they have never heard of us, which you know, I don't find surprising at all, because nurses and midwives are so busy. I assume that they don't remember it because they don't need it at the time. So, you know, another way of looking at that is that that's a positive thing. It's not a bad thing. But actually, yeah, the more that people are talking about us and you know, sharing that we are available for support, and, you know, that we're confidential and free service for nurses and midwives, the better. So that's, hopefully that kind of answers that question. And the other one that, oh, no, I'm handing over to Glenn, sorry.
Thanks, Carolyn. So one of the other questions, which is a really good one. So what strategies are good to assist nursing students? And this can also, there's a similar answer to the next couple of questions, which are combined. So I've noticed myself becoming very critical of others and behaving in a way I normally wouldn't. Why and how can I stop? And also, how do we obtain a sense of community for our nursing or our student nurses during this enforced online learning experience? So the thing is that it's really important to connect. And I'd also throw graduate nurses and midwives into that category as well. It's important to try to reflect on everything that you do. So around your practice, your relationships, your own health, the different things that are taking place for you. And if it's helpful to record these down so that you've got a sense of a baseline to see whether they're moving, to see whether they're changing, to see whether your motivation is improving or decreasing. Connecting with others who you trust is really important in this. So that could be people in your own life, your home life, I'm sorry, or in your professional life. So just to be open to them, to be vulnerable with them, to ensure that they can tap you on the shoulder and to see if you're okay. Reflect back on the red flags. So around the question around you notice you becoming critical of others, look at the red flags that we spoke about earlier, and then stop, reflect, ask what's changed. And for a lot of us, a lot of things have changed, but then we need to sort of implement some change. And we can help with that. We can be a support service that can help start that change if and when that's required. Over to you, Carolyn.
So my next question was post calling a code. So for those of you who work in the clinical area, managing a MET call, how to look after yourself. So, you know, having worked in acute care areas, my first recommendation is to breathe and to make sure you're keeping your breath steady and consistent, because it will be the thing that will, you know, keep your mind functioning well. It's very normal to have that fight or flight response, very normal to be shaky afterwards, very normal to be, you know, you can be really quite alarmed. You know, that's like how anyone responds to fear, and there is always fear in that, you know, that you're actually looking after someone else's life. So, you know, I was thinking about, like, often hospitals will have a debriefing session. So really to tap into that and to tap into your nurse educators or your managers about the process of debriefing and being able to talk about how you went and how you felt and what that was. And in some cases, when that's not available, you know, I highly recommend you can ring NM support would be one place to ring to talk about that and your thoughts and feelings around that, so it doesn't ruminate and you don't get stuck into a, you know, where you've got red flags going up. EAP, of course, is available for people. One of the things that used to work for me is always making sure that when I work, I have a trusted colleague that I'm working with, you know, and just identifying the person that I trust. And in whatever circumstance, if I need to talk to them, and that I've established that relationship and that connection with them. And I don't think it hurts to actually, you know, reach out to someone and say, do you know, I actually really trust you. Could you be my, you know, my connection person this shift? You know, like actually just naming it and actually making that something that you two share. And then you can go and speak to them in situations like this. Yeah, it can be really scary, you know, like it's really scary the first time that happens, and you know, you see some nurses like just deal with that very easily, but actually like that response is very natural. Yeah. And the other thing that I practice now on a regular basis is mindfulness, because it gives me that ability to come back to the present. And whenever you're in the present moment, that fight or flight response can't, it doesn't happen in the body. It gives you some relief. So if you can start to practice that, or take yourself away and just concentrate on your breath for a few minutes and just get back into the present moment. So I hope that that helps. And I think it's over to Kayanne.
Yeah. Hi. I've got a question here. Is there some specific support for nurses regarding COVID-19 stressors? Look, my perspective on this is that since the start of this, we've been bombarded with information from a range of places. We've funneled it down, and because we are a nurse-focused or nursing and midwifery-focused service, I believe our website really, gives you the answers. Have a look at the website. It provides a range of nurse-focused strategies to manage the impact of COVID. We invite nurses and midwives too who have tested positive or who are in the middle of being tested and waiting results and are fearful to give us a call. The government and the union sites will keep you up to date with your legal and industrial and health and safety info, but certainly use our website or ring us if there's anything else happening for you that's related to COVID. Basically I advise though that on a day-to-day basis, you really check in with yourself, focus on taking it from day to day. Try and think outside the box a little bit at the moment. Try things that are new ways of coping, new ways of thinking. Don't be afraid to look at your thoughts and your feelings and your fears. That's all they are, okay? They don't have hands and legs. They can't make you do anything you don't want to. Look them straight in the eye, okay? I'm like Carolyn, I practice mindfulness regularly. I have done for many years, and it really helps me keep in the moment, in present. I don't find myself spiraling out of control and getting anxious. I think the other thing to take into account that these situations can bring out both the best and the worst in ourselves and in others. So you might see behaviours in yourself that you're surprised. You might find yourself looking at your colleagues with feeling absolutely perplexed and shocked that they'd even say that, Just be aware that people are out of sync at the moment. They are out of sorts, and we need to be a little bit tolerant and forgiving of each other, and certainly very empathic. Finally, again, back to the website. Do a self-care plan. Go on our website, and this is an opportunity to click onto our website, have a look at the resource kit, do a self-care plan, bring back into focus what you can do for yourself during this time. Okay.
Thanks very much, Carolyn and Kayanne. We need to move on. Unfortunately, there's a few questions that will have gone unanswered. If that was one of yours and you would like an answer to that question, feel free to give us a call. We do apologise. Before we move on, and we'll be getting the self-care polling results back up shortly. But firstly, I just wanted to take you through our self-care plan and take you to our website. And I'll be sharing this on the screen now so you can have a look at it. So basically, that's what our website looks like. You'll see this blue function, this blue tile here is directly related to that COVID information that Kayanne was talking about, which is really condensed and quite helpful, we believe. But what I wanted to sort of take you through now is our health and wellbeing self-care plan. So you go to the health and wellbeing link there. That will take you to this page. And on this page, we're looking for the toolkit resources. Click on complete the self-care plan. It will ask you if you'd like to subscribe to our newsletter. Of course you will. There's an explanation which follows, introducing you to the self-care plan, how to develop it, its purpose, its outcome. Let's turn the light back on. And importantly, around your privacy and how the information is used. Now, I'm not going to go through this and do it with you and for you now, but it's very self-explanatory. And what that does, it will, once you've completed it, it will send you a report. And the report is your self-care plan in its simplest form. So it can be used, you can print it off, you can keep it on your phone, you can put it on the fridge, you can use it in a way which will hopefully you will find beneficial. I'll just go back to the health and wellbeing section again and go down further. And the self-care resource toolkit, which Kayanne was talking about, is on this page also. Click on the download the resource toolkit, and there's an extremely comprehensive array of services there. Very simple to use, very simple to follow, easy to use. So I won't go through that any further. So if you do have some time, have a look at the website. There's that, and there's many other pieces of information which can be helpful to you. So I might just get that poll up if we can, and we'll see what you said. So what would help you to prioritize self-care? So 55% people have said work support. Support from partner was friends and family, 40%. 40% was schedule the time. I think that's a really important aspect. Planning and organising doesn't just happen. We need to put some time and effort into that. So thank you very much for that. Now we'll throw it back to Mark, who possibly has got some questions which have come through today.
Thanks very much, Glenn, and thanks very much, Carol and Kayanne, for the fantastic conversation today. And we hope today we've demystified what the Nursing Midwifery Health Program of Victoria does. And no doubt you have still some questions, and we're going to answer those now. So first up, really early on, we got a great question from Bridget. How do you have the conversation with a colleague that may need support or has health issue concerns? And I know Kayanne pretty extensively answered that, and Bridget came back and said, thanks very much, and it was simple as asking, are you okay? And Bridget also loves the butterfly analogy, so thanks very much for sharing that, Carolyn. So Kayanne, I'll give you that question back to you, if that's okay. And is there anything you would add to that? Because sometimes asking a colleague who you see is struggling, are you okay, is not actually as simple as we think it would be.
No, it's certainly not. You've got to set it up. You've got to choose a time and a place where there's privacy, there's a box of tissues on the table next to you, and that you've got the time to actually listen if they respond and engage with you. You also have to accept that if the person says, look, I'm fine, don't worry about me, extend the invitation. Come back to me if you do want to talk about something. Keep it open, okay? And just be aware that people might need to go away and reflect, why did they ask me? What are things changing that much for me? But essentially it is about giving them privacy, giving them space, respecting their responses, and remaining open. When you ask, are you okay, you're not going to be the person that then solves the problem for them. What we're hoping is that you'll then link them to us, say, look, you know, why don't you ring the Nursing Midwifery Health Program and just talk about it? You don't even have to give them your name. Just ring and ask for an appointment. And that can be the start of quite a lot of change for a person.
Thanks very much, Kayanne. That's really helpful. And Bridget, thanks for those great questions and the feedback. Vicky asked the question, what is offered and how do you access support? And I think we pretty extensively answered that question throughout this webinar. So thanks very much to all the panelists for those terrific answers and responses to that question. And Vicky, if there is a question in there that we didn't answer, feel free to put it in the chat room now, and we will we'll answer it before the end of the webinar. There was a really great question about confidentiality, and do we actually have to break confidentiality if the issue that, or the concern the person's phoning or contacting us about is causing harm to others or self? And Glenn, I might get you to answer that if that's okay.
Sure, thanks, Mark. And it's a really important question that we do get asked a lot. So essentially, it's a voluntary program. It's confidential. However, if there's any concerns around an individual's own health and safety, immediate health and safety, or the health and safety of another party that individual could be impacting, then we will consider, we do consider breaking that confidentiality. We do work very closely with the individual to ensure that they're aware of what we're thinking, and we're very upfront at the start of the relationship to inform them about what our obligations are, because we are obliged as is every other nurse and midwife and the registered practitioners of the 14 professions registered with ARPA around the country, to ensure that we are keeping the public safe. But having said that, it's something that is very, very rare that we have to do. And we work very closely with our participants to ensure that they're clearly informed about what our responsibilities are.
Thanks very much, Glenn. That's really informative. We've got another question about what disciplines do we have on the team and what experience and qualifications the team members have. And I think that's a really great question, because if you're contacting our service for support, you actually want to know that the team members are qualified and skilled to support you. So that was answered, I think, to an extent, where the team members introduced themselves, and in some of the questions or responses that were posed to the questions. But Glenn, would you like to elaborate on that at all in relation to the team?
Well, just to say, Mark, that we've got everyone that works on the program has got a minimum of a couple of decades of experience, which is a good thing, and sometimes it can be a bit of a deficit, but we believe that that's a good thing. Where we have representation of nurses from the general fields, the mental health fields, and midwives. And we each have postgraduate qualifications and experience in the areas of alcohol and drug mental health. So we do see ourselves as a safe entry point into the service system. We may not be the organisation or the support that ultimately holds you through an episode, but we certainly will be there to support you, to hold your hand, and to refer you on to someone who is better qualified than us, should there be like a specific concern that's identified throughout the assessment and the time with us.
Thanks, Glenn. And one last question. We previously ran a support group, and one of the participants of the webinar today is curious about whether we're going to run that support group again. So Glenn, I think that's another question for you, if that's okay.
Yes, it is. Thank you, and thanks for the question. So we actually ceased that group, but we're in the process. We consulted the membership at the time of ceasing that group and got their feedback, which was was a minimal amount, but we felt that it was an opportunity for us to review what we were doing and how we were doing it. Now, coincidentally, this was just before the COVID-19 pandemic hit, and the world's different now, and we'll be using the technology, I believe, to really enhance the connection that we're going to have with groups of nurses and midwives out in the field. But also we're looking at how we can, and this was meant to have been happening in the last few months, but has been halted because of these events, these world events, that we will be looking at how we can, if there's still a place for that type of a group, that we can provide for our colleagues. So watch this space. It's certainly something that's on the drawing board.
Thanks very much, Glenn. And as we're getting very close to the end of the webinar, I'll wrap it up shortly, but I'm wondering if there's any final words of wisdom from our fabulous panelists today. And Carolyn, do you have a final word of wisdom you'd like to share?
Excellent. Yes, I do have a final word of wisdom. Only that no problem is too big or too small. So, if you know of anyone or you yourself need any support, please give us a call.
Thanks, Carolyn. That's great. And Kayanne, I know you'll have a final word of wisdom because you're so full of wisdom.
Oh, here we go. Look, basically, I just want to say, don't wait. So many nurses are reluctant to ask for help for all of the reasons we've discussed today. Don't wait till you're in crisis. Look at the red flags. If the red flags are there, that's when you ring us. Please do.
Thanks, Kayanne. And Glenn, a final comment or word of wisdom from you.
Look, just to say that if you're experiencing something which is uncomfortable for you, there's a chance that somebody else around you has and is. And just to be open to the possibility that that support can be beneficial to you. And a phone call is all it takes. So yeah, if that's required, we hope you can do that. Thank you.
Thanks very much, Glenn. And thank you very much to all the webinar participants for attending today and your excellent questions and for being incredibly interactive and generous. We really appreciate it. We've videoed the webinar, so we'll put it up on our website shortly. And if you could share that with your colleagues that may need to know about us or may need to tell somebody else about us, we would really appreciate that. We're really interested in your feedback in relation to today's webinar. So there'll be a survey that will be in your browser after you leave the webinar today. It will only take a couple of minutes to complete, and we'd really appreciate your feedback because it will assist us in planning future webinars. So thanks very much for that. Once again, our contact details are 9415 7551 or via the website www.nmhp.org.au. Or you can phone Nurse and Midwife Support, the National Support Service, on 1800 667 877. The service is anonymous, confidential and free, and it's available 24/7, no matter where you live in Australia. You can contact the service also via the website nmsupport.org.au. Those two services work very collaboratively together, and indeed, as I said at the beginning of the webinar, I work for both services. So our final call to action is to you to really look after yourselves, particularly in this challenging time that we find ourselves in. Complete your self-care plan, print it out, put it on your fridge or somewhere prominent at home so people in your life can connect with it as well and support you to engage in your self-care. Please access the resource toolkit, and if there's something that you're looking for that you don't find there, please let us know because we'd love to provide that for you. So once again, thanks very, very much for being part of this webinar, and we're looking forward to speaking to you next time. Bye for now.
Bye.